Okay, let's talk about anxiolytics, which are also known as tranquilizers, and the sedative hypnotics. All right, as I just said, the anxiolytics are also known as tranquilizers. Okay, and so one of the first things that we're going to do is talk about what these drugs were used for from an historical perspective. Okay, why am I saying from an historical perspective? Because today these drugs can be used for many different things, and so we want to talk about what they were first developed for. Um, then consider, how they're used today. Okay, so tranquilizers and anxiolytics were developed to uh, treat the symptoms of anxiety and to relieve agitation. So, if people were extremely agitated, feeling anxious, then they were administered tranquilizers or anxiolytics. Okay, same class of drugs here that we're talking about. Okay, so to relieve agitation, to treat the symptoms of anxiety. Okay, and so we want to talk about the most important characteristic for a drug that's going to be used as a tranquilizer anxiolytic. So, of course, we want it to calm the person down, to relieve the agitation, to relieve the anxiety. But that's not what we mean when we talk about an important characteristic for the drug uh, to have. If we're talking about an effective or desirable tranquilizer anxiolytic, we want a fast acting drug that has a long duration of action. You want something that can relieve the agitation or the anxiety, relatively quickly, but you want it to have long lasting effects. You don't want to be anxious again in 45 minutes. Okay? Now, let me put a little bit of that in perspective because we know that some of the anxiolytics that are used nowadays take several weeks before you see any therapeutic effects. But that is still considered relatively fast acting. But on the other hand, you have some other drugs that you give a person an injection, and within minutes, that person is calmed down or the agitation is relieved. And so that's a little bit different to relieve the agitation that quickly versus to alleviate symptoms of an anxiety related disorder very quickly. Okay, so again, from an historical perspective, these drugs were developed to treat the symptoms of anxiety, relieve the symptoms of anxiety, to treat agitation. And you want a fast acting drug with a long duration of action. Okay? Now, sedative hypnotics are also known as central nervous system depressants because they depress activity in the central nervous system. From an historical perspective, these drugs were developed as sleep aids. Okay, you'll notice I'll say sleep aids. Okay, because they were developed to help people who were having sleeping problems, to help those individuals get to sleep. Okay, now I'm careful to say that because a sedative, okay, a state of sedation is qualitatively and also in terms of electrophysiology different from the state that we call sleep. Okay, and so that's why I'm careful to say that these were developed as sleep aids. Okay, you reduce the activity in the central nervous system, the individual is less responsive to stimuli, so therefore hopefully able to get to sleep more easily. Okay, now this one you have to think about a little bit when you think about the most important characteristic for a drug, or most important characteristics for a drug that you want to use as a sedative hypnotic. Here you want a fast acting drug, but here you also want a drug that's of short duration. Okay, now let me explain that. In terms of its maximal sedative effects, you want a drug that's of short duration. The idea is that once the individual is asleep, then hopefully they will be able to stay asleep. One of the problems with a lot of the oldest sedative hypnotics or oldest sleep aids was that there were a lot of carryover effects. People still being sedated the day after. And so this is why you want a fast acting drug, but you want a short acting drug. You want to be able to function the next day. If you've ever seen commercials that are advertising prescription sleep aids, etc., most of them will say, if you listen to the fast talk in those commercials, please be sure, that you have at least 8 hours to dedicate to sleep before taking this medication. Please do not operate any heavy equipment, etc., etc. So you hear all these warnings, okay? And we're going to talk about, why why some of these effects are seen. Okay, and so we talk about these things from a historical perspective, that they were developed as sleep aids, and hopefully, once the person gets to sleep, they'd be able to stay asleep on their own. That's from the historical perspective. We know that today the sedative hypnotics or sleep aids are formulated a bit differently, because you'll see the commercials that say, do you have trouble turning the light out? It has a little lamp. Do you have trouble keeping the light out once it's out? And so now you have control release or extended release tablets that will release the drug over some period of time, so that there's a relatively stable amount that's maintained in the bloodstream to help the individual stay asleep. Okay, and so these are cases where you're not necessarily increasing the amount of medication. They're just changing how it gets released so that there's a steady level that's maintained in the bloodstream. Okay. Now, the sedative hypnotics are probably one of the most commonly used and abused drugs in America. Why is that? Well, that's because alcohol has those, at high doses, is a sedative hypnotic. And because alcohol is so highly abused and could be included in this class of drugs, this makes the sedative hypnotics one of the most commonly used and abused classes of drugs in America. Okay, there are quite a few things that are associated with the drug, which are not necessarily desirable. Toxicity and lethality. A little bit later in the chapter, we're going to talk again about how these drugs are central nervous system depressants, and how you could easily shut down the autonomic centers in the brain, or shut down the areas of the brain that are responsible for respiration. And we're going to talk about the synergistic or additive effects that it has with alcohol, or at least the barbiturates will have with alcohol. You have social disruptiveness, so you have disinhibition, and people will participate in behaviors that are just socially disruptive, not acceptable. And then, of course, we have both psychological and physical dependence associated with the sedative hypnotics, with sleep aids, with people becoming physically dependent on these, needing these drugs to fall asleep. And then, of course, the psychological dependence, feeling like they, or believing that they won't be able to get to sleep unless they have this medication. Okay. One of the things to recognize when we talk about the sleep aids in particular, is that there's usually an underlying medical or psychological issue that is preventing the person from getting to sleep. And so sleep aids are really a type of band-aid, okay? Because unless the underlying problems are identified, which often it's very difficult to do that, but unless those underlying problems are identified and treated, then the sleep aids are just bandages. And few people know that sleep aids were never intended for long-term use. And so typically people should only be on them for a couple of weeks. You should really not have individuals that are on sleep aids for years and years, because they were never developed for that purpose. Okay. Let's talk a little bit about what's going to be common to both the tranquilizers, anxiolytics, and the sedative hypnotics. In other words, we're talking about how are these drugs alike in what they do. Okay? Now, uh, both types of these drugs, the tranquilizers, anxiolytics, and your sedative hypnotics, both of these drugs, both of these types of drugs are GABA agonist. Okay, remember we've talked about GABA a little bit. GABA, remember, is the major inhibitory neurotransmitter uh, in the brain, okay, associated with those chloride ion channels. So both of these drugs are GABA agonists. Both of these drugs increase GABAergic transmission. Okay, and we'll revisit that a little bit later because we're talking about how they're alike and what they do, and then a little bit later we're going to talk about you know how they are dissimilar and how they do what they do. Okay, uh, this is just a slide that's helping you to be able to identify sedative hypnotics or tranquilizers and anxiolytics when you see them in your text, or just if you encounter them in your readings or talking to individuals. Um, Drugs that we call barbiturates are generally sedative hypnotics. Okay, these drugs end in ate and all, so you'll see we have barbiturate. Okay, but you may have phenobarbital, secobarbital, pentobarbital. Okay, those are your barbiturate drugs. Okay, your sedative hypnotics. When we refer to tranquilizers and anxiolytics, these drugs are often what we call benzodiazepines. Okay, and so you may see BDZ. Okay, these drugs generally end in ene, ides, and am. So you'll see here benzodiazepine, but you could also have diazepam, chlordiazepoxide, fluoxetine, things like that. Okay, so again, when you see eights and alls in this chapter, those are generally your barbiturates or your sedative hypnotics. When you see the enes, the ides, and the ams, those are generally going to be your tranquilizers or anxiolytic drugs. Okay, now one of the things that we'll talk about in terms of their pharmacokinetic properties, any given barbiturate differs from another barbiturate, and any given benzodiazepine drug differs from any other benzodiazepine drug based on three properties: how quickly they act, how strong they act, and their duration of action. So to simplify that, I often like to say how quick, how long, and how strong. Okay, and that is going to lead us in just a bit into discussion of lipid solubility. Okay, because the lipid solubility of these drugs are going to determine how quickly these drugs get into the bloodstream, and then thus how quickly they act. And their lipid solubility is going to be one of the things that's going to affect their duration of action. So again, any one barbiturate drug differs from another barbiturate in how quickly they act, how long they act, and the strength of action. Any one benzodiazepine drug differs from another benzodiazepine drug in how quickly they act, how strong they act, and their duration of action. Okay? So we just want to review briefly factors that can influence the rate at which tolerance develops to any given drug. Remember, this is going to be the dose, because the dose has to be one that's going to create that functional disturbance, and then the time between doses. So we want to talk very generally about which tranquilizers, anxiolytics, or sedative hypnotics are most likely to be abused. These are going to be the ones that have a strong intensity in terms of their action, but those that so in other words, those that pack a punch. Okay, but the other thing is going to be those that have, pack-a-punch, fast-acting, but short duration of action. Okay, because remember, when we talk about the rate at which tolerance develops, dose, time between doses, those drugs that pack a punch but don't have long-lasting effects, in other words, those that have short-lasting effects, the individual would take more often. Remember, the more often they take the drug, then the body is going to get better at counteracting the effects of the drug so that the individual is less susceptible. Okay, so the tranquilizers, anxiolytics, sedative hypnotics that pack a punch, fast acting, but short duration of action are going to be the ones that are more likely or most likely to be abused. Okay, now these are just some examples. I am not going to test you on these, but these are just some examples of how those drugs can differ in their duration of action. Thiopental, which is primarily an anesthetic, fast-acting, ultra-short duration, 15 minutes. Secobarbital, that has a duration of an hour and a half. Pentobarbital and amobarbital, approximately 4 hours, and then phenobarbital, approximately 6 hours. Okay. And I'm actually going to stop there, and then I will pick back up with the administration and absorption.